As we age, our health becomes even more important, but also, more delicate. Heart attacks and strokes are two of the most serious health challenges facing older adults today. But here's the good news. With the right knowledge and daily habits, we can greatly reduce the risk, and even recover better if one does occur. In this video, we'll talk about what heart attacks and strokes really are, their warning signs, the major risk factors, and how lifestyle, diet, and natural therapies, both modern and Ayurvedic, can help protect your heart and brain, even in your golden years. Let's begin by understanding what these conditions mean. A heart attack happens when the blood flow to a part of the heart is blocked, often by a clot or a buildup of fatty deposits called plaque. Without enough blood, that part of the heart muscle begins to die. A stroke, on the other hand, affects the brain. It happens when blood flow to part of the brain is cut off, either by a clot, which is called an ischemic stroke, or by a burst blood vessel, known as a hemorrhagic stroke. Both are life-threatening and require immediate medical attention, but they often start silently, and honestly, prevention is far better than cure. Knowing the warning signs can save lives. Here's what to look out for. Chest pain or tightness, often described as pressure or squeezing, pain radiating to the arm, jaw, neck, or back, shortness of breath, cold sweat, nausea or dizziness, sudden numbness or weakness in the face, arm, or leg, especially on one side, trouble speaking or understanding, blurred or lost vision in one or both eyes, loss of balance, coordination, or severe headache. Remember, fast for stroke, face drooping, arm weakness, speech difficulty, time to call emergency services. Many of the causes behind heart attacks and strokes overlap. They include high blood pressure, high cholesterol, type 2 diabetes, smoking, a sedentary lifestyle, obesity or excess belly fat, and chronic stress or depression. Age also increases risk, as does family history, but the biggest influence is how we live our lives every day. Fortunately, change is always possible, no matter your age. Let's talk food, because what you eat every day is one of the strongest medicines you have. Fresh fruits and vegetables, especially leafy greens, berries, and beets, are so important. Whole grains like oats, brown rice, and millets should be a regular part of your meals. Nuts and seeds, in moderation, think almonds, flaxseed, and walnuts, are great choices. Choose healthy oils such as olive oil or cold-pressed sesame oil whenever you can. And don't forget legumes and beans for plant-based protein. Fried and processed foods, sugary snacks and sodas, excess salt and red meat, and trans fats, found in many packaged goods, are best limited or avoided. A Mediterranean-style diet and Ayurvedic principles often overlap. Both promote balance, natural ingredients, and freshness. Ayurveda, India's ancient system of medicine, offers gentle yet powerful tools for heart and brain wellness, especially suited for seniors. Arjuna bark, or Terminalia Arjuna, is traditionally used to strengthen the heart and support blood pressure. Ashwagandha calms the nervous system and lowers stress-related cortisol. Triphala aids digestion and detoxification, keeping blood vessels clean. Guggle helps reduce cholesterol and improves circulation. And turmeric or curcumin is anti-inflammatory and antioxidant-rich. These herbs should be taken under the guidance of a qualified Ayurvedic doctor, especially if you're already on medication. Regular movement is key. Even gentle exercise can work wonders. Try, 20 to 30 minutes of brisk walking a day, chair yoga or gentle stretching, tai chi or slow movement exercises for balance, light strength training with bands or small weights, and deep breathing or pranayama to calm the heart and mind. Exercise improves circulation, lowers blood pressure, and boosts your mood, all essential for heart and brain health. If you or a loved one has already had a heart attack or stroke, recovery takes time, but with the right approach, much can be restored. Recovery includes medication management and checkups, physiotherapy and movement, stress reduction through meditation or mindfulness, a heart-healthy diet and gentle herbal support, as well as emotional connection with family, friends, or support groups. In Ayurveda, rasayana therapies, which rejuvenate the body, are often used in recovery, including herbal tonics, oils, and restorative treatments like abhyanga or oil massage, and shirodhara, which is oil streaming on the forehead. The heart is not just a pump, and the brain is not just a machine. They are both deeply connected to how we live, how we feel, and how we treat ourselves. By eating wisely, moving gently, thinking positively, and embracing both modern and natural wisdom, we can live longer, fuller, and more joyful lives. Whether you're in your 60s, 70s, or beyond, it's never too late to care for your heart and mind. Subscribe for more natural wellness tips tailored for seniors, and share this with someone who may need it. Stay safe, stay vibrant, and stay connected to life.